Well, live long enough and there's a good chance you will develop cataracts. What's not good is the new research that shows not having the condition corrected could put you at higher risk for having a serious automobile accident or even suffering a broken bone due to a fall or osteoporosis.
The good news is there are some simple surgical solutions that can have you seeing clearer. And you'll find some of the nation's best eye surgeons right here in Sioux Falls. Dr. John Berdahl with Vance Thompson Vision is one of them. Thank you so much for joining us today, Dr. John Berdahl.
It's great to be here again.
So start by explaining to me, what is a cataract?
So a cataract is when the lens inside your eye becomes cloudy. When you're young, this is clear and it's flexible, and so that focuses light on the retina. As we get older, the first thing we lose is its flexibility. That's what causes reading glasses. Then over time it becomes cloudy, and that's what we call a cataract. It actually stands for, the word stands for waterfall, when water was clear and then it becomes white and cloudy and you can't see through it. So there used to be the old Cataract Motel in Sioux Falls because of the falls.
Oh, that makes sense. So how common is it to have cataracts?
If you live long enough, you're going to get cataracts. So,
Okay.
so it's a good thing if you've had your cataracts taken out, because that means you've lived a long, vibrant life.
So do all cataracts require surgery? Is this something that we need to have a procedure for?
So in your 50s and 60s, almost everybody has the beginnings of a cataract, and they don't really, you don't need surgery for them until they stop you from doing something you like. And the first thing that people usually notice is they start to not feel comfortable driving at night. If you're in your 50s, 60s, 70s, and you're not feeling like headlights are your friend at nighttime, cataract surgery is probably in the cards.
Okay, so what exactly does this look like for someone who's experiencing cataracts and maybe doesn't even know they are?
Yeah, so what you'll notice is that when headlights come at you, you kind of want to look away, and there's glare around those headlights, and you can't see the, fog line or the yellow midline, and you don't feel comfortable.
So if I don't need surgery for this, why should I consider it?
Yeah, so really any surgery we're going to do, we're going to wait until it's going to make your life better. The nice thing about cataract surgery is that it's so safe that the reasons to have them have gotten pushed up, and so people have been having cataract surgery younger and younger because they want to see better and better sooner.
So walk me through this procedure and tell me what goes on during a cataract
Most
surgery.
common surgery done in the United States.
Oh, really?
And usually we don't even have to start an IV to sedate you. We give you a little sedation underneath your tongue that makes you relaxed. You come back, we prep the eye, and then we make 2 small incisions in the eye. Sometimes we use a laser. We use a little ultrasound probe to take the cataract out. It's kind of like an M&M, where you take the top of the candy shell off, scoop out all the chocolate, leave the shell in place, put a little lens in there, and then we're done, without stitches, without an IV, and seeing better usually 24 to 48 hours afterwards.
Okay, so explain to me exactly how aware I am during this procedure.
Yeah, so we do it in an operating room. Sometimes it's done in a hospital, but most of the time it's done in an ambulatory surgery center. You come to the office, you don't change out of your street clothes, we bring you back into the operating room in a sterile environment, and it usually takes somewhere between 6 and 10 minutes. I mean, it depends on if there's some that can be more complicated, but not typically. Usually it goes pretty quick.
So what would you say are patients' #1 concern when it comes to cataract surgery?
It's really fascinating that you asked that, because I would have said that it would be fear. That people are scared to have
is it going to hurt?
Right. Is it going to hurt? Am I going to lose my vision? All that kind of stuff. There is a huge study that was done recently, and people's #1 concern is how long until they can get back to their normal life. And so the answer to that question is you can get back to your life pretty quickly. Basically, we remove all the restrictions within a couple of days after cataract surgery if everything went well.
So what exactly does that recovery process look like? Say from the moment I get done with the surgery.
From the moment you get done with surgery, actually your vision can sometimes be pretty good right when you get out of surgery, and then it gets worse a little bit as the cornea swells after surgery, and then the pupil stays big. As the pupil gets normal sized and the cornea swelling goes away, 24 to 48 hours usually, that vision comes around and you feel like you're up to your regular self. And I usually tell people, take the day of surgery off work and the day after surgery off work, and then you're back to your regular activities.
Okay, so let's talk about the treatment options. Say I'm deciding I want to go through this and I want to get surgery for my cataracts. What are my options?
The biggest question you have to say is, how do you want to use your eyes? Do you want to wear glasses all the time? Do you want to wear them a little, or do you want to wear them not much at all? And so most people say, I don't mind my glasses, and we'll do standard cataract surgery and insurance pays for that. But a lot of people say, boy, if this is my chance to get out of glasses and not have to wear them as much, we'll put in a built-in bifocal or a lens that fixes astigmatism, or both. And the vast majority of those patients don't have to wear their glasses for much of anything. It's exactly what I did for my mom when I did her cataract surgery, is a built-in bifocal lens, and she hasn't worn her glasses since.
So you said that a lot of times people will just do the first option you mentioned. So why do you think that is?
I think that it's mostly about cost, because it's expensive to do that, and a lot of people don't mind their glasses. And so I think that the biggest, if insurance paid for all of them, it'd be a no-brainer. We'd do the majority of them with the built-in bifocals, but it doesn't, and so there is a cost associated with it.
So how do you and the doctors here at Vance Thompson Vision work with patients and help them decide what treatment option they should do and if they should even have a procedure?
Yeah, so the first thing that we do is we try to listen. And so if you say, hey, I'm not able to drive at night, or I can't read a book comfortably, okay. And then we look and we say, you have a cataract. You have a cataract. We can make you see better. We should take your cataract out. Now the bigger decision is, how do you want to use your eyes afterwards? Would you prefer to wear glasses, or would you prefer not to wear glasses? I'd prefer not to wear glasses. Okay, we've got a couple of options. They're expensive. It costs a couple of $1,000s per eye to use this technology so you wouldn't have to wear glasses as much. Is that something that you're interested in? Does it fit in your life? Because I feel like as a doctor, the first thing that we need to do is take care of the patient as a patient, everything in their life, and then make sure we're doing the right thing for the eye. And so let's just help us fit the technology that's going to accomplish your goals and fit in your life, both financially and for whatever professional activities you have.
All right, thank you so much, Dr. John Berdahl, for all the great information today.
It's great, thanks.
If you'd like to find out whether a cataract procedure could give you back clearer vision and better night vision, or you're wondering whether you could be experiencing the signs of cataracts, call Vance Thompson Vision in Sioux Falls at 605-361-3937 or visit their website at vancethompsonvision.com. KELOland Living viewers will also find a free cataract checklist on that website, or you can give them a call. Again, that number is 605-361-3937. You'll also find the answers to frequently asked questions about cataract online as well. Be sure and tell them you heard about it on KELOland Living.